Hi, everyone. I just want to double check that you can hear me and see my slides.
Yes.
Wonderful. Well, it's great to be here today, and I am presenting in place of Laura Gottlieb, who's the director of SIREN and who unfortunately was not able to be with you due to a family emergency. I'm going to be talking to you today about gaps in our knowledge about the impact of social care interventions that are conducted in the healthcare setting. And this work comes from, for those of you who are not familiar with SIREN, we're a research, synthesis, and dissemination initiative at the University of California, San Francisco. The focus is specifically on building the evidence base about how health systems can address social risks and social conditions. And so, as you can imagine, we do a lot of thinking about exactly this question of what does the research evidence tell us and where are the gaps. So I'm excited to be able to share some of that with you today. I want to start out by giving you just a little bit of a framework that we have started using in our work that comes from the National Academies committee that's been working over the past year on thinking about the integration of social and medical care, and that a number of folks in the room are a part of. And this committee has come up with the following framework for the kinds of activities that the healthcare sector can engage in around social risks. And it breaks it down into 5 categories, starting with the first 3 that are really focused on clinical care and the last 2 that tend to be at the community level, and starts with awareness or identification of social risks, generally through screening. Adjustment activities, these get talked about a lot less, but it's basically the way in which providers and care teams may modify care to improve its effectiveness, to mitigate the impact of the social risks and the barriers to health that patients may experience from those. The third is the category of activities that this state has been focused on, which is activities that assist patients to connect to resources to address social barriers to health. And the last 2 are activities related to alignment, advocacy, and using the full range of healthcare resources to help improve social conditions at the community level. In the interest of time, I'm not going to focus on those today, but I just wanted to highlight them, that's an area that it's worthwhile thinking about in this whole framework. I want to do one last framing things before jumping into the meat of this, and that's that we tend to think at SIREN of research gaps as falling into 2 buckets. One is gaps around effectiveness, so really understanding what works, why, and how, and for whom. And the other one is around implementation. And implementation is really more about the nuts and bolts of how do you get this to work in a care setting. And also, once you know what interventions are effective, how do we encourage adoption of those interventions? So I'm going to turn now to talking about the first bucket of activities in the National Academies framework, which is around awareness or identification of social needs. And here, one of the key questions that remains unanswered, and this is despite the fact that there's really a lot of interest and work happening currently around measurement of social risks in healthcare settings. So it turns out that despite the widespread interest and use of screening tools in healthcare settings, there's still a lot of gaps in our understanding of the best way to identify needs and the best way to identify the patients who can benefit from the kinds of interventions that can be deployed in the healthcare sector. So Kara Lewis and Nora Henriksen and their team at Kaiser Permanente, Washington, did a review over the past year and a half of multi-domain social risk screening tools. They identified 21, and they compared them in terms of what kind of validity testing had been done. And they found that across all these 21 tools, the median number of quality validity tests that had been done was 2 out of a possible of 8 that can be done. So that tells us that there's a lot more work that we need to do to identify valid and effective ways to screen. Another really interesting study highlights the fact that how you ask these questions does matter. Stacy Lindau and her team at the University of Chicago did some interesting work looking at how even small changes in the Hunger Vital Signs instrument, which is very widely used to measure food insecurity, changes the percentage of patients that screen positive. So we need to do more work on social risk screening tools. One of the other really, I think, important questions to raise up in the area of assessment and understanding social risks is the The fact that a number of studies on social risk screening are showing that among patients who screen positive, not all of them want help when they're offered help in the healthcare setting. And in fact, as many as 50 to 80% of them in some studies do not want help. That's a big drop-off, and we don't really know exactly why that is. It may be that the tools being used are too sensitive and they're identifying people who don't have current needs, or who are identifying needs that aren't the most important needs that people are facing in their lives, and so they don't want help with that need at that time. It's also possible that people don't want help from the healthcare setting or don't think that they can get help through their healthcare setting. But it's been a very consistent finding that we're seeing in all studies that have looked at compare the percent that screen positive to those who want help, and there's been a drop-off in all of the studies that have looked at that, and so it's clear that that's another area where research is needed. The other, there we go. The other area that is, I think, an area where research is needed is around understanding acceptability among patients. And this is a concern that a number of folks have raised, including Arvind Garg, about the potential for stigmatizing patients, making patients feel bad, and also the potential for discrimination based on information identified through social risk screening. So that's another area where there's research needed. We have helped coordinate a multi-site study that will be coming out in the fall, and the preliminary results of which were presented at the February National Research Meeting that we helped organize, that actually suggests that acceptability may be very high, at least among the 1,000 patients that we interviewed at 10 different sites. There was a striking similarity across all sites in high acceptability for screening. There were some concerns. Patients were a little less comfortable with their data being stored in the electronic health record, but our results suggest that there may be relatively high acceptability among patients. Still, that's one study, and more research is needed. So that was highlighting validity and acceptability. I think that the other area where there's going to be need, as I was mentioning earlier, is in understanding implementation for adoption and sustainability. And here there are questions around the health IT supports that can be provided, the training that can be provided to help clinical workforce feel comfortable doing this and have the competence to do it, and then the policy and payment models that can help incentivize this once we've identified whether and how to do this. I want to switch really quickly and highlight adjustment. So this is an area that has received very little attention. There is one study that we are aware of that has specifically looked at this and found that among providers who were given access to data about social risk, they reported that it changed how they provided care, although there was not much detail provided about that. And so there are a lot of questions here on how providers may change care based on this and personalize interventions. So, for example, choose medications that are less costly, or think of interventions that will be most appropriate for people who may be struggling with food insecurity, for example. And I think research needs to be done to look at the impacts of care adjustment activities on the experience of care, on health impacts, on health equity, and on utilization. I think in this area, one of the things that is particularly important to think about and look at is ensure that that this information is not used again in any way to discriminate or to lower standards of care. What we are talking about are adjustments to improve the effectiveness of care, but obviously there's a fine line between that and changing standards of care and lowering standards of care. And so we want to make sure to highlight that here. Turning now to assistance. So this is interventions that seek to actually address the health-related social needs that are barriers to better health outcomes for patients. And here I want to start by highlighting the results of a review that Dr. Gottlieb and her colleagues conducted and published in 2016. They looked at the research literature to identify basically all intervention studies that had looked at the impact of social risk interventions in healthcare settings. A total of nearly 5,000 articles were identified between 2000 and 2017. And among all of those, only 67 actually were intervention studies that allowed interpretation about the impact of social risk interventions. There were another 81 that were intervention studies, but that looked at a whole set of intervention components, among which were social risk interventions, but they didn't isolate the impact of the social risk components. Still, among the 67, only 10% would be considered high quality, and only 30% examined health outcomes, and 20% examined health utilization and cost outcomes. So as of this review, which was published actually in 2017, this indicates that at that time there were a relatively small number of studies. They were mostly not great quality, and most of them focused on process and social risk outcomes and not health and utilization outcomes. So thinking about the effectiveness gaps, really one of the biggest gaps that we have still is better understanding how different assistance activities impact health and for which patients and via which mechanisms. There are a lot of different ways of intervening, and we are beginning to see studies that are looking at health impacts. I think some assessed work highlights that. Laura's team has done some work and others, but we still need a lot more studies to be able to really know which are the interventions that are going to have the biggest impact for particular patients and in which context. I think another area where we have not seen enough research at all is really looking at health equity impacts. Everybody here is thinking about these interventions are meant to impact health equity, but very few people are actually looking at those impacts, and we know that if you're not specifically trying to impact health equity, you can in fact not have an impact on health equity or have the opposite impact, so it's important to look at that outcome. And a number of studies are accumulating around utilization and healthcare costs. The Commonwealth Fund is in the process of finalizing a review of this literature and has identified over 50 studies in this space, but there's still a lot of questions due to the heterogeneity of interventions being tested and outcomes, and so I think that's another area. And then finally, I want to highlight the importance of also looking at patient and provider experience of care. These have cost implications for health systems and are also obviously incredibly important for understanding quality of care and impact on health. And so those are areas where we don't yet have enough research. The other piece that I want to highlight at the bottom of this slide is around implementation questions. Obviously, once we have identified the interventions that are most effective, there are a lot of additional research questions then about what are the supports that are needed, whether health IT, training, again, policy and payment incentives that can help drive adoption of these effective interventions. And then another area that I want to highlight that's an important one to look at is the impact on social service organizations. I think there's a lot of questions about this. There's been some work done in Massachusetts to begin looking at that, and I think a number of other places around the country, but that's an area where we need to look more at what are the impacts of these interventions on social service organizations. So in summary, interventions from our perspective directed at social risks are promising, but not yet well studied or not yet well studied enough. Effectiveness studies should include a wider array of outcomes, and in particular focus on health outcomes and on health equity outcomes. Apologies for the way these are showing up. And then we also need a lot of implementation studies to understand then how to best implement these and how to drive adoption once we understand what works. So I want to stop there, and we'll look forward to questions in the Q&A part of the presentation.